Somebody raise their hand. All right. A seizure is an episode of abnormality, synchronized and high-frequency firing of neurons. So it's kind of like, the way to think of this is like an ectopic foci in the heart. What does that cause? AFib. This is AFib of the brain. All right, so a neuron fires it's not supposed to, sets up a set of neurons that fire together, and that causes a seizure. They can have a convulsion is a grand mal seizure. So it's an intense paroxysm of involuntary repetitive muscular contractions. And when you see a grand mal, it's pretty impressive. And epilepsy is a tendency to have recurrent unprovoked seizures. So you can have seizures for a number of reasons. People who withdraw from alcohol have seizures. People who withdraw from benzodiazepines can have seizures. Little children that have a high fever can have seizures. All right, that's not epilepsy, that's just a seizure. Epilepsy is a series of seizures that are uncontrolled and unpredictable. It affects about 1% of the population. 2/3 begin in childhood. The other third begins as a result usually of trauma. Head trauma, some damage to the brain that didn't cause the seizures. Oh, somebody asked me this at break and I wanted to tell you. Unlike Liz's regular lectures where you get the slides ahead of time, I prefer not to do that because I'd rather you pay attention to what I'm saying rather than leafing through the slides. But she will give you a set of slides. You don't have to type out every one of these slides. So if you've been doing that, relax. I will make sure she gets a copy of the slides to you. All right. The incidence rises after 60 as well, and that's with brain tumors, alcoholism, and stroke. I see a lot of it in the alcohol and drug detox units. How do we prevent it? We put them on a Valium protocol, so they get decreasing amounts of Valium, so they don't seize from withdrawal from the alcohol. And we can control that, so they're not drunk, but they aren't taking Valium. Yeah.
Are they most often preceded by like Nora, like a lot of these seizures, or
not the alcoholic seizures?
Doesn't have to be that way.
They just stand there talking to you 1 minute, drop to the floor, and seize it. And that's very impressive because they don't show any sign whatsoever of even being ill, other than they have a tremor. So when I taught the nurses this because they didn't. This piece of paper. Oh, yes, it is right here. Nope, that's stuck down too. If I get a piece of paper. If I stick my hand out, what they do, and they're not doing it now because now they've been exposed to me, but the nurses used to say, put your hands out, let me see if you have a tremor. Well, guess what? If you have a tremor, fine tremor, you won't see it. Maybe faster than you can see. But if you put a piece of paper on somebody's hand, and they have a tremor, it will show. I don't, that's why I'm a surgeon. But even regular people have little tremors like this. And it shows up with a piece of paper on it. Ever stick that paper on your hand? Let's see. Dominant hand. Yeah, see? It's shaking. It's normal to have some tremor. Nervous wreck? Yeah, that's why I came in late. You thought I forgot it. Oh, okay, so that's what we get from alcoholics. If they've got a tremor, if the tremor's showing up, we give them some Valium so they don't seize. All right, because I have seen that. I've seen what they call social detox units as opposed to chemical detox. In social detox, essentially, they give you a bed and watch you withdraw. Not nice. But in those units, oftentimes, the patients will have seizures. Brain doesn't like alcohol. Okay, so this defines the various types of seizures. The partials Usually, absent seizures are the most common partial seizures. But you can have partial seizures of any part of the body. So you can have one arm shake, you know, or something like that. That's a partial seizure. And then the complex seizures could be simple partial, where there's they have impairment of consciousness, or it could be complex partials, which include general grand mal seizures. The typical seizure that we see are absent seizures. Petit mals are much more common, especially in children. What we'll get is child brought to the doctor because he or she's not paying attention to class, and what they're having is absent seizures. All right, they usually don't get a lot of warning, so they just all of a sudden are staring off into space, and the teacher's like, well, they don't pay attention. Okay. When the consciousness is spared, there are motor, sensory, visual, and auditory symptoms, hand twitching, flashes of light, called scotomata. All right, those could be seen. Auras that take place, you can have all kinds of auras: smell, sight, hearing. I had one guy who told me he always had smelled an odor that smelled like baked ham right before he had a seizure. It's like, okay, that's an interesting one. Usually it's a bad smell, but I've heard one person told me he could smell bread baking. That was another one that he said smelled all the world like bread baking. And another one is bananas. Why do you think bananas? Why any of those? Why baked ham? Why bread? Why would that be something you might smell? It has to do with a chemical compound called amine. All right, we have amines in our body, so the right combination of amines causing the aura causes that sensation to smell. So, isn't it nice to know that banana bread has its smell because of some chemical? All right. In the complex partial seizures, there's an impairment of consciousness. Most common are localized to the temporal lobe. Initial seizures, symptoms they have an aura, and it's followed by unresponsiveness and loss of awareness called what blank state? What state? Not catatonic. Post-ictal. Post-ictal state is after a seizure. And usually they're just kind of out of it. By the way, the temporal lobe is also responsible for various complex behaviors, including anger. And there's such a thing as a temporal lobe seizure where the individual throws a fit, punches somebody out, or gets into fights all the time, and it's because of a temporal lobe seizure. And of course gets misdiagnosed instead of just having borderline personality disorder. What they really are having is temporal lobe seizure. Again, in the real world, where the differential diagnosis isn't, this is some sort of seizure, but this is some sort of disease, it's very hard to tell sometimes that you're looking at this. So this sounds real straightforward. Oh yeah, they have an aura, but that may not come up. That may be some guy who's been put in jail a couple of times for fighting at a bar or whatever, and they never figure out they got temporal lobe epilepsy. Until, you know, some smart clinician figures out that, hey, something's not right here, does an EEG and finds out the guy has temporal lobe epilepsy. Or he has a tumor and finally has a full-blown grand mal seizure, and they go, oh, look, he's got a tumor in his temporal lobe. And that's what caused all this behavioral change. A lot of times people will talk about behavioral changes due to tumors, and that's because they're having partial complex seizures, but not grand mal. All right, generalized seizures or grand mal seizures look like, well, like a fish flopping on the floor, essentially. All right, and after the seizure, they're immobile, flaccid, unresponsive, but that goes away within a few minutes. And then they're tired and confused afterwards and may not remember the seizure at all. May not even know they had a seizure. Yeah.
My mom has epilepsy, so do all the women in my family. The whole tongue biting thing, when my mom had her first seizure, her roommates put a pencil in her mouth and called 911. So can you explain, like, they don't want you to bite your tongue, they don't want
Well, first of all, you don't usually bite your tongue. That happens sometimes because some of the seizures involve tongue thrusting.
Okay.
So if they're thrusting your tongue out and biting down, yeah, they could actually bite on their own tongue.
Okay.
But that's pretty uncommon. Unfortunately, the general public says, oh, you stick a pen in their mouth. Yeah, it breaks their teeth.
Yeah,
Or put your fingers in their mouth and have her bite your fingers off. If you're going to put something in somebody's mouth that's having a seizure, maybe your wallet would be okay. All right, because it's soft and you won't break teeth and nothing else will happen. And they'll still be able to breathe past it. But you can imagine sticking something in somebody's mouth is occluding their airway. That's probably not a good idea. All right, the American Red Cross response to seizure is to turn the person on their side so if they vomit, they don't aspirate their vomitus, but not to put anything in their mouth. All right, that's Squad 51 stuff. That's TV. All right, you don't really do that, and certainly you don't put your fingers anywhere near their mouth, or you're liable to lose them. That's what the EEG looks like. You can't hardly read this, but this shows a no or a seizure, and then there's various types of seizures. But you see, that's what the brain's doing, which is certainly not normal. This is before the seizure, and this is after. They just mark down various types of seizures here. Interesting, but again, you're never going to read an EEG as a raw piece of data. You're going to see a report from the neurologist. Yes.
How many episodes of seizures would one normally have before being diagnosed with epilepsy?
Well, that's impossible to say. You can have one grand mal seizure and you can start picking it up. Get an EEG, do a sleep study, and find out you have epilepsy. So that varies a lot. But there's also a condition where you go into status epilepticus. You might have heard that term, or you may hear that term. Status epilepticus means they're having constant seizure. Seizure doesn't stop, they keep seizing. And that can be fatal if you don't intervene. What do you think you would intervene with? What would you think would be the drug of choice to stop a seizure? Anybody? Take a guess? Short-acting benzodiazepine or moderate. So, Xanax or Valium. Since Valium comes in an injectable form, Valium IV will stop a seizure. I've done a few of those. Paramedics carry Valium in their ambulance usually. I've done a few of those as a paramedic. Break the seizure. Obviously, the longer seizure goes on, the more damage to the muscles, and also it impairs the respiratory system. All right, so episodes can be brief, episodes of staring and unresponsiveness of less than 10 seconds. You can imagine how hard that is to diagnose. All right, often induced by hyperventilation. Anybody got an idea why that happens? So if I cause you to hyperventilate and then you seize, why would that happen? You actually alluded to it before. You get acidotic, you blow off the CO2. So you produce respiratory alkalosis and metabolic acidosis. So they become acidotic locally. Okay. May exhibit a 3-second twitching of the eyes or the fingers. Twitching the eyes are referred to as nystagmus. So you may pick up nystagmus on a person. This is visual nystagmus. You don't have to count the number of beats their eyes are going like this. Associated with a 3-second spike and wave discharges in the EEG. That's equivalent to a QRS in the heart. There was a movie, an old movie that some of you might have seen called Andromeda Strain, and her seizure, the scientist's seizure, is set off by a flashing light. The flashing light is at a frequency that's equal to the frequency of her brain waves, and that sets off a seizure. Do you guys think that's possible? No, it's science fiction. So. All right. Andromeda Strain was written by the fellow that did Michael Crichton, who did ER. So he's a doctor. So he also knows how to lie too. So there you go. It can often occur several times a day and affect the performance in school. I knew I read that somewhere. It was what I was going over the slide. But yeah, that's usually where it turns up, because if you're having less than 10-second absences 3 or 4 times a day and you're in class, you might miss some stuff. Kind of like coming late. Yeah, we had a partial seizure. Okay, and that's kind of what it looks like. See, it's a real short burst of abnormal brainwave. I don't pretend to be able to read these things, but at least I know that that's what those spikes mean. Okay, this is a kind of busy slide. This is on, we're done with epilepsy, now we're going to start on tumors, something that I know more about.